So that's the chemistry set. So let me just explain what happens on the street that makes me a bit crazy. You have a patient who eats a lot of fat and sugary foods. They don't exercise. They have too much alcohol in their diet. And they're just the everyday stiff on the street, living the North American lifestyle, and they think everything's great. They go for their annual checkup. Their blood pressure is high. Their triglycerides are elevated. Their cholesterol is slightly elevated. And they have high blood pressure, as I said. And they're showing signs of fasting glucose that's too high on their way to being a diabetic. The way physicians are trained today, they say, I got to change these numbers. I have to put this person on a combination of antihypertensive drugs to get the blood pressure down. I'm going to put them on a statin drug to get the cholesterol down. I'm going to put them on niacin or fibric acid to bring the triglycerides down. And I'm going to give them drugs, and we'll see these later on in diabetes. I'm going to give them a drug to increase the amount of insulin they pump out at every meal so they can bring the glucose levels down into the normal range. Right? And because they're pre-diabetic, I think I better put them on an ACE inhibitor to protect their kidneys. And their blood seems a bit sticky because they're eating all these high-fat foods. Maybe I'll put them on Plavix or an anticoagulant as well. Person's on 6 drugs. I say, give that patient to me. And let me put them onto a 30 to 40-minute endurance exercise program 5 times a week. Make the dietary changes to lower fatty foods that are not problematic. Change some of the carbohydrate foods they eat without it being really restrictive. Let me get the weight off. Let me get alcohol out of their diet or bring it into something that's more rational. Let me give them the right supplements. And I can produce all the effects that we want in most cases. I've had lots of patients where I've done it. The blood pressure comes down, cholesterol comes down, triglyceride comes down, and their fasting glucose is normal, and their blood stickiness goes into the normal range because exercise improves the platelet adhesive index improves. Essential fatty acids do the same thing. Eating more fish does the same thing. You see, what I'm saying is that lifestyle medicine can actually undo so much of this. But a conventional doctor is trained to give them up to 6 different drugs just to do what I'm showing you now. And I say, the patient, in my view, should at least be given the option to make an informed decision about what they might want to do to help manage this themselves. If the patient is weak and lazy, doesn't have the constitution to make any changes, in my opinion, they need all these. They need the drugs because it does lower risk and does help to create a better risk profile. But the patient should at least be given the lifestyle modification option, in my view. And of course, if they're smoking, it just adds to the problem. So what's the natural management of hyperlipidemia? Diet, exercise, supplementation. 90% of people, it's been proven that 90% of people can get their cholesterol into the ideal range without medication, if they want to do it. So the foods that have all those high fats in them that are so undesirable, as you know, red meat, lamb, pork, a lot of organ meats, any milk or dairy, any milk or yogurt that's above 1% milk fat, any cheese above 4% milk fat, cocoa butter, regular chocolate products have a lot of saturated fat. Palm and coconut oil, they don't raise cholesterol to the same degree, but they still make platelets sticky and they still have a cholesterol raising effect overall, so be very careful. Egg yolks already have a lot of cholesterol right in the yolk itself. I prefer for the patient to eat the egg white. And also hydrogenated fats and fried foods add to the problem. So the person that has the best evidence for this, and you know, once you graduate and you have more time, I would encourage you to read the books by Dr. Dean Ornish. He's a medical doctor at Stanford. He's the only person on the planet showing with pre- and post-angiography studies that you can take these high-risk people with advanced vascular disease, put them on a lifestyle modification program where you take these foods out in gentle endurance exercise and mind-body yoga, meditation. Now he's even using supplements. He's been shown he can reverse atherosclerosis to a significant degree without any medication, bring their cholesterol down, get them into a lower risk profile without risk of further episodes that are life-threatening with lifestyle modification. Now, he's really strict because he has high-risk patients, so they're almost on a completely vegan diet, lots of soy protein in there, lots of soluble fiber. But again, meditation, visualization, and the amount of endurance exercise the person can tolerate based on their cardiac index. So what you don't want to happen over your lifetime, and you want to tell your patients how important this is, because this is how most people die. 40% of all the people you're going to meet in your lifetime, this is how they're going to die, and so much of it is preventable that it's tragic in the modern era where we know so much about how to prevent disease, that people aren't really armed with the lifestyle tools to do what could be great importance to them. Stop that plaque, especially from occurring where there's bifurcations in, say, the left and right coronary vessel. Or the plaque builds up in the carotid artery, and then a piece of it breaks off and floats upstream into a small blood vessel, causing a sudden stroke out of nowhere. This is an actual slide of somebody with atherosclerosis. Here's the cholesterol buildup here. These are all the foam cells. This is the only area left for the blood to flow through the lumen right there. This is what a clogged artery looks like when you get to an advanced stage. So how do you lower cholesterol naturally? Well, you decrease all those bad fats that we talked about. And you decrease the trans fats as part of that. And you increase soluble fiber, right? Fruits and vegetables, peas and beans, ground flaxseed, 2 tablespoons a day, 2 to 3 teaspoons a day of psyllium husk fiber, about 1/3 of a cup of oat bran. All these things have been shown to drag cholesterol out of the body or not stimulate the over-secretion of cholesterol in the first place. There are supplements that have also been proven to lower cholesterol further that I think you should know about and use in appropriate cases. Guggul, the resin from the mucal mirror tree in India that gives rise to this particular substance that's been shown to increase the clearance of LDL cholesterol from the bloodstream. So you bring the cholesterol down without damaging the liver. It's not blocking cholesterol synthesis. But Guggul, when it's standardized to these steroidal compounds known as Guggul sterones at a 2.5% grade, if you give enough of it, so you yield 75 milligrams a day, it can lower cholesterol to a very significant degree, actually, as you're going. I think we're going to see studies. Yes, you're going to see it can lower total cholesterol by up to 27% in just a 3-month period. So I love Guggul. And I also love Artichoke Leaf Extract, which flushes a lot of bile through the liver and gallbladder into the intestinal tract, so more of it will leave in fecal matter, so the liver will open up its doors and clear more cholesterol from the bloodstream. You can lower cholesterol by giving Artichoke Leaf Extract at the dosage that you see here. So, of course, what I did at Adeeva is I created a product called Cholesterex. It has the Guggul and the Artichoke Leaf Extract, but the person has to take 2 capsules 3 times a day to get a dramatic cholesterol lowering effect. I usually first have them make the dietary changes first and exercise. If it doesn't get their cholesterol into the range that is ideal, then I will add supplements at that point. And if I can't get it down, then I would tell them to take medications as required to get it into the ideal range. Garlic extract has a very mild effect on lowering cholesterol. As I told you, I don't like it because it's a powerful anticoagulant. You don't want to create bleeding disorders. And there's an agent found in rice bran oil called gamma-arasenol, which is very important, very good at helping to manage menopausal symptoms, and it just happens to have a nice cholesterol-lowering effect. So for a woman going through menopause, gamma-arasenol in sort of a natural menopause formulation can help block some of the symptoms of menopause naturally and also help keep her cholesterol in the lower range at a dose of 150 milligrams twice a day. So with Guggul, as I said, it's from the mucal mirror tree. It's in the Indian medical system, it's the gold standard treatment for lowering cholesterol, because how many people in India can afford statin drugs? You know, maybe like a very small percentage of the population. And so the majority of people, doctors there, recommend Guggul because it works so well, clearing LDL from the bloodstream, lowers total cholesterol by up to 27%, lowers triglycerides by up to 30% in the same 3-month period, improves the HDL to LDL ratio, totally non-toxic, and no drug-nutrient interactions. That means you can use it even if the person's already on a statin drug. You can say, listen, we can add this, and let's see if your doctor will be able to slowly lower your dose of the statin drug or maybe take you off it completely, which I've seen happen. And the studies on artichoke leaf extract I put on the next slide. It explains how artichoke leaf can help to flush a lot of bile through into the GI tract and lower the total cholesterol load on the body. And you see some of the studies reported here in the year 2000. So I created this. I'm very proud of this because I've seen it really help a lot of people. That has the gum Guggul and the Artichoke Leaf extract in Cholesterol, but there's other products in the market that are doing similar things. What's important to me when I look at a patient is that I want their total fasting cholesterol to be at or below 3.9. That's where you don't have heart attacks. Now that's using the American units, that would be 150 milligrams per deciliter. The higher up you go, the greater is the risk of somebody dying prematurely from coronary heart disease. You clog the arteries faster as the total cholesterol rises. So a total cholesterol of below 3.9 is the most ideal. And the second best place to be, because not everybody can get below 3.9. The second best place to be is below 4.7, which is at 180 milligrams per deciliter. But I try to get people to 3.9 or lower. My own total cholesterol is well below 3.9. But I eat according to the recommendations I make for other people. Ideally, I'd like the patient's total cholesterol to be below 3.9. That means the person's been in a 12 to 14-hour fast, then the blood work gets drawn. That's a fasting cholesterol level, as opposed to a random cholesterol level where it could be taken at any point in the day. It could be right after a meal. That doesn't tell you anything. The person has to fast for 12 to 14 hours. The blood is drawn. Knowing their fasting cholesterol is very important. Medical doctors don't usually get excited until the person's cholesterol is above 5.2 millimoles per liter, which is also about 200 milligrams per deciliter in the American units. But where people have the least amount of chance of having a heart attack or a vascular episode is at a cholesterol level lower than that. 3.9 is much more ideal than 5.2. But then as you break it down, that's the total cholesterol. Of the total cholesterol, you don't want the LDL to be any more than 2.5. To be quite honest with you, I like the LDL to be below 2 or below 1.8, to be honest with you. In very high-risk patients, people who've already had heart attacks, people with kidney disease, people that are diabetics, they try to get the LDL cholesterol down below 1.8. So where there's a high-risk situation, they want the person below 1.8. I personally want everybody below 1.8 regardless. And triglycerides should be below 1.5 millimoles per liter. I'll hold you accountable on the exam for that. The ideal range for triglycerides is below 1.5 millimoles per liter, which is also 132 milligrams per deciliter. And the fasting glucose should be below 5 millimoles per liter, which is below 90 milligrams per deciliter. And the reason why you want the blood sugar to be that low is because when glucose levels rise, they sugar coat proteins in the bloodstream, forming these advanced glycosylated end products. And these sugar-coated proteins can then lodge in the tiny blood vessels, and it leads to blindness as people get older. It leads to kidney damage that can cause renal failure as people get older. And it can create inflammation in the blood vessel wall. And inflammation in the blood vessel wall is also related to an increased risk of cardiovascular episodes. So keeping the triglyceride levels down and glucose levels down is as important as keeping the cholesterol in the ideal range. So